Nehawu remaining unwavering in its demand for a 10% wage increase. It's vowing to not stop their strike action until they get what they say they deserve. Some of its members are blocking access to the all-important Charlotte Maxeke hospital here in Johannesburg. And eNCA's Manqoba Mchunu has been outside the facility monitoring the situation the last few hours. And he joins us there now. Manqoba, those striking workers rather set that this is where they're going to stay and they're not going to give in anytime soon.
Well, certainly, Michelle, that's what the workers are saying. In fact, they're saying that they're not going to stop their protest up until government exceeds to their 10% demand. They're saying that government's 4% proposed wage increase is a slap in the face. It's an insult, given the fact that the cost of living has also increased, and many of them are saying that they simply can't afford, to go to shops to buy for their children, to pay for their children's school fees, because of the increasing cost of living. And so they're saying that they are going to continue their protest. It has intensified, Marcel. You recall, of course, that the workers have been on protest since Monday, but we're not seeing the strike taking this format that it's taking, where all the entrances to the hospital's gates have been closed. They've been blockaded with rocks and burning tires in some instances. But we're also seeing patients being turned away. Many of them that had come here hoping to get some service, hoping to get help in terms of some of their ailments, but they were told to come back and set appointments for other dates. We spoke to quite a number of them, including an 89-year-old woman who was here. She had to also go back home. She did not receive any of her medication, but also seen even those living with disabilities are also being forced to turn back as a result of this strike. But earlier on, I spoke to one of those patients about what they had been coming to do here and how this is affecting them, and this is what they had to say.
Son needs to have his tonsils removed, so he's booked for theatre next week, and we needed to schedule what is happening, and he needed to have his last checkup done. So now we've been sent home telling us that they'll call us to give us new appointments and to tell us when to come back. Yes.
It must be a huge inconvenience.
Yes, it is, but there's other people that's sick as well inside the hospital that needs doctors and medical treatment. So it's not just that we are important, but there are more important people in there that needs assistance.
It's a situation you can't control. Unfortunately, we've left home very, very early hours of the morning because you come here and you wait because the queuing systems are so long. And then when you get here, you discover now, because of the protest, unfortunately, her situation has gone from bad to worse. She needed to prepare herself for the operation. And now we come here, you must know all the costs incurred. They say they're not allowed to see it to us. And it sets everything back. But what's worse is I took note that there's very, very old people walking from here to the entrance. That's almost like 1.5 kilometers. And they should at least do something for those people, you know.
Mfethu yazi besine appointment yange-8 yabona. Umfowethu uphukile la unyawo mfethu. Manje masifika la sithola kune strike and makhona akukho umuntu osizayo next anabakhonanga nokusinikeza amaphilisi something nyana next and namanje ngikhala ngayo ngoba manje angazi nokuthi amaphilisi ngizowathatha kuphi akukho mali akukho lutho mali yokugibela nayo siyayibhatanisa yikho nje start because la esihlala khona sihlalela le ngase Rostenville nakhona kumele sigibele kayi2 so sigibela kayi4 manje sesilahlekelwe maybe 100 and something sokungokwesibili lokwenzakala yayibona so angazi ukuthi kahle basinikeze idate yange4 sika April and nakhona sokumele sibuyele endlini siyozama ukuhlanganisa leyo mali and mayena usenkingeni ngoba umhlungu ubuzwa everyday akalale nombone nje yayibona akalale.
Manqoba, very interesting and disheartening to hear the situation with regards to potential patients or people who have loved ones that need healthcare in the hospital. When I spoke to Kasatu earlier, they were saying when it comes to essential services like hospitals, they really think it should be up to the CEOs of the various hospitals to be dealing with potential striking workers, just to ensure how essential services can go ahead, because they say you cannot just have a blanket ban on everybody who works in essential services, and it should just be certain pockets or units that are allowed to continue with their services. Have we heard anything from management at the hospital, and what more do we know about how they're managing under the current set of circumstances?
Well, Marcelo, we've been trying to reach out to the hospital. In fact, I spoke to the spokesperson of the hospital just for certain how operations have been affected. And Marcelo, I can tell you that, I mean, it's been quite difficult to get a hold of the hospital's spokesperson. In fact, I was given a number that I was meant to call, and that number rang unanswered. So we haven't heard myself from the hospital management as far as operations are concerned, but what we do see here is a number of workers from the hospital. Nurses are here. We've seen them here out on the streets in their full uniform, and this just tells you that a lot of services have been affected inside. We understand that they're running at skeleton staff inside some of these wards. There are at least 1 or 2 nurses. They are tending to the wards, but the number of workers are out here on the streets. We've also tried to reach out to the Gauteng Health Department just to ascertain the impact that this has had, but we've also not been able to get anyone from the health department to speak to us on the impact so far. But I can tell you that a lot of services have been disrupted at the hospital, and these workers saying that they're going to continue on the picket line up until their demands are met.
Okay, Manqoba Mchunu with the very latest there from outside Charlotte Maxeke Hospital here in Johannesburg.